The first thing you need to do is you need to make an introduction to the patient. You need to tell the patient what is your name and what are the purpose of you coming. For instance, in this scenario, we are going to change the patient's clothes. So first of all, you need to bring the necessary equipment. And in this case, I'm bringing in the blanket so that they can cover their body while they are changing their clothes. The next step is to remove the patient's clothes from the side which is healthy. In this case, the patient injured her right hand, and therefore we need to begin removing the clothes from her left side. And now we're beginning to remove the clothes from the injured side of the patient. We need to lift the arm gently and also start removing the clothes slowly. The next step is to remove the patient's clothes. If your patient's cloth is dirty and it has contaminated your glove, make sure to replace it. When you want to change the patient's clothes with a new one, you have to start and begin with the right side, which is the injured arm. If the patient injured his or her left hand, then you have to start with that side. After you've helped the patient put on their clothes on their injured side, you can continue on the opposite side. Remove the blanket once the patient has completed changing their clothes. Fold the blanket and you can remove the blanket from the room. When you're dealing with patients who do not suffer from any injury on their arm, the thing that you have to do is to make an introduction. Afterwards, you should ask the patient if the patient requires your assistance. In this scenario, the patient said that she does not require my assistance. Therefore, I told her about the location of her clothes and I left the room. In this scenario, the patient, although did not suffer from any injury on her arm, she said that she requires my help in changing her clothes. So the first thing that I did was I told her that I'm going to take the equipment first. I left the room and put on my gloves and also bring in the blanket. After the blanket has been placed properly on her, I came back with the clothes and gave it to her. If the patient did not suffer from any injuries on her limbs, then you can ask them on which side do they prefer to begin. If the patient wants to put on their clothes on the right side first, then you should assist them in doing so. After the patient is ready, you can take back the blanket and fold it and remove it from the room. Don't forget to remove the gloves once you've finished your task.